Nearly 6 in 10 women over 50 report discomfort or loss of sensitivity during self-pleasure, and the reason isn't what they think. Most repeat the same techniques for decades, unaware that hormonal and nerve changes after menopause make those habits harmful. In this video, I'll explain the real medical mistakes mature women make and what science says to do instead. Hello, I'm Dr. Eliza Hart, a board-certified obstetrician and gynecologist with over 15 years of experience in women's hormonal health. I've guided thousands of women through menopause and intimate changes, helping them understand that reduced sensitivity isn't aging, but a biological shift that can be corrected with knowledge and care. After 50, estrogen levels fall by more than half, pelvic circulation slows, and the nerves responsible for pleasure become less responsive. These changes are normal, but rarely explained. Most women continue the same stimulation patterns they learned decades ago, unaware that their body's needs have changed. The result is frustration, discomfort, and the false belief that pleasure simply fades with age. Before we begin, please subscribe and help me reach my first 10,000 subscribers. It truly keeps me motivated to create more science-based guidance for women like you. Type 1 in the comments if this resonates, or 0 if there's a topic you'd like me to explain in future videos. So let's look at the most common mistake women over 50 often repeat. 1. Using the same stimulation technique for decades. For many women, the habits that once felt familiar have quietly turned into a source of confusion. What worked effortlessly in their 30s or 40s may now leave them wondering why their bodies no longer respond with the same intensity. This is not a failure of desire or vitality. It is the natural outcome of biological evolution that accompanies the post-menopausal years. After menopause, estrogen production can decline by more than 50%, directly reducing blood flow to the clitoral and vaginal tissues. When circulation decreases, the small sensory nerves that once transmitted pleasure signals lose responsiveness. The surrounding skin also becomes thinner and more delicate because the collagen and elastin fibers that support it are no longer stimulated by estrogen. Many women instinctively react by applying more pressure or moving faster, hoping to recreate the sensation they remember. Unfortunately, this approach often worsens the problem. Repetitive friction against tissue with limited lubrication can desensitize the superficial nerves even further. From a medical perspective, the clitoris is not a single structure, but a network of nerve branches that extend deeply into the pelvis. When blood flow is reduced, the entire network receives less oxygen, which makes it harder for the brain to register pleasurable signals. Instead of the quick, sharp responses that occurred years ago, arousal now requires a slower buildup of warmth and vascular expansion. A study from the Journal of Sexual Medicine found that women who incorporated gradual stimulation and breathing relaxation before touch increased clitoral oxygenation by almost 30%. That change alone restored both sensitivity and comfort. Emotionally, many women interpret this shift as a sign of decline, which creates subtle anxiety that further tightens the pelvic muscles and restricts blood flow. The key is to replace repetition with awareness. Start by allowing the body 5 to 10 minutes to relax before touch, gentle breathing, warmth, and hydration. All prepare the tissue to respond naturally. Think of it as retraining your body's reflexes rather than chasing an old sensation. With consistent attention to circulation and comfort, sensitivity often returns within weeks. As we continue, it's important to understand that even the most mindful technique cannot work if the body lacks its essential natural lubrication. That's the next major mistake many women overlook. 2. Ignoring lubrication and vaginal dryness. One of the most overlooked causes of discomfort during self-pleasure after 50 is the gradual loss of natural lubrication. For many women, this change appears so slowly that they hardly notice it at first until dryness begins to cause friction, irritation, or even small tears. What seems like a lack of arousal is in fact a biological reaction to hormonal decline, not a loss of interest or femininity. As estrogen levels drop, the vaginal epithelium loses its thick protective layers of glycogen, and the mucosal glands that once provided moisture become less active. The result is a thinner, more fragile surface that struggles to stay hydrated. When this dryness is ignored, even light stimulation can cause microabrasions that trigger inflammation and over time create an association between touch and discomfort. This feedback loop conditions the brain to avoid arousal, not because the body can't respond, but because it remembers pain instead of pleasure. Clinically, this condition is known as vaginal atrophy, and it affects more than half of postmenopausal women. Studies from the North American Menopause Society confirm that reduced estrogen also alters the vaginal microbiome, increasing pH levels and decreasing natural elasticity. These shifts are not permanent, but they do require proactive care. Medical-grade lubricants and topical therapies can completely change the experience. Water-based or silicone-based products, when free from fragrance or glycerin, restore glide and reduce friction without disrupting vaginal balance. For some women, low-dose estriol or DHE creams prescribed by a physician can help rejuvenate the tissues and rebuild natural moisture within weeks. Beyond the physical changes, dryness also carries emotional weight. Many women equate the need for lubricant with aging or decline, when in truth it is simply maintenance. No different from moisturizing the skin or hydrating the body. Restoring comfort allows the nervous system to relax again, signaling safety and receptivity instead of tension. Once lubrication is restored, sensitivity naturally increases, but how you approach timing and pace also matters deeply. Many women unintentionally rush through the process, missing the slower rhythm their postmenopausal bodies now require. That's the next mistake we'll address. 3. Rushing the process. In today's fast-paced lives, slowing down often feels like a luxury even in the most private moments. Many women tell me they simply don't have the time approaching self-pleasure with the same urgency they use to finish daily tasks. This hurried approach, though, understandable conflicts directly with how the female body functions after menopause. The mature body does not respond to speed. It responds to patience, safety, and consistent oxygenation. From a biological standpoint, arousal depends heavily on the parasympathetic nervous system, the branch responsible for relaxation, digestion, and restoration. When a woman rushes, her sympathetic system dominates instead, releasing cortisol and adrenaline, the same hormones triggered by stress. Elevated cortisol constricts blood vessels in the pelvis, reducing oxygen flow to the genital area. Without sufficient circulation, the tissues cannot swell or lubricate properly, leading to dull or painful sensations. Even if an orgasm occurs, it tends to feel shallow and unsatisfying because the body never reached full physiological readiness. Research published in the Journal of Women's Health shows that mindful pacing during arousal improves genital blood flow and increases oxytocin, the hormone that supports bonding and relaxation, by as much as 40%. This means that slowing down is not only psychological advice, it's a measurable medical intervention that enhances both comfort and intensity. On the emotional level, rushing reinforces the subconscious message that your pleasure is secondary or undeserved. After years of caregiving and responsibility, many women struggle to prioritize themselves without guilt. This mindset quietly blocks arousal because the brain remains in task mode, not sensory mode. The key to reversing this pattern is deliberate presence, giving yourself full permission to experience without a deadline. Before you begin, take 2 or 3 minutes of deep, steady breathing. Inhale through the nose for 4 seconds. Exhale for 6. This simple rhythm shifts the body into parasympathetic balance and opens blood flow to the pelvic region. Allow sensations to build gradually, treating the process not as a performance, but as nourishment. Once the body slows and oxygen flows freely again, a new awareness begins to form, one that extends beyond the genitals themselves. That leads us to the next common mistake, limiting pleasure to a single physical location instead of engaging the body as a whole. 4. Focusing only on the genital area. Many women unknowingly limit their own pleasure by focusing solely on one small part of the body. They treat arousal as a localized event rather than a full body experience shaped by hormones, nerves, and circulation. What often begins as a practical habit can over time become a barrier to deeper sensitivity. From a physiological perspective, the genital region is only one element of a much larger sensory network. The clitoris alone contains over 8,000 nerve endings, but its responsiveness depends on how well the surrounding nerves along the thigh's abdomen, chest, and lower back communicate with the brain. These areas are connected through the vagus and pudendal nerves, which carry sensory input to the brain's limbic system, where pleasure is interpreted. When stimulation is confined to one point, these broader pathways remain underactivated, and the brain receives weaker pleasure signals overall. Research in neurophysiology shows that gentle, varied stimulation across multiple regions increases blood flow to the pelvis by nearly 25% and activates the same oxytocin pathways involved in trust and emotional bonding. In other words, when you include the rest of your body, you are not just expanding sensation, you are improving the body's hormonal response as well. Emotionally, this shift can feel transformative. Many women in midlife describe feeling disconnected from their bodies, especially after years of stress or caregiving. Engaging the skin beyond the genital area helps reestablish sensory memory, reminding the brain that touch can still mean comfort, not just function. Something as simple as tracing the sides of the torso or the inner arms before genital touch can calm the nervous system and enhance arousal naturally. If you've reached this point in the video, I'd love to hear from you. Type "I'm learning" in the comments if this information helps you see your body differently, or share one insight that surprised you the most so far. Your feedback helps me understand what topics truly matter to you, and it tells the algorithm that more women deserve accurate, science-based education like this. Now that we've explored how the body's sensory network operates as a whole, we need to address an even subtler factor: the emotional connection that either supports or suppresses physical pleasure. 5. Disconnecting emotionally during self-touch. While most women recognize the physical changes that come with menopause, few realize how profoundly the mind influences their body's ability to feel. Emotional detachment is one of the most silent yet powerful barriers to pleasure. Many women describe going through the motions of self-touch without really being present, feeling distant, mechanical, or even numb. From a clinical standpoint, this isn't about desire disappearing. It's about the nervous system remaining in a state of alertness rather than relaxation. When a woman carries years of shame or discomfort around sexuality, her brain stores that tension in the amygdala, the region that governs fear and threat responses. When activated, the amygdala suppresses the nucleus accumbens, which controls the brain's reward circuit and dopamine release. As a result, pleasure signals weaken muscles, tighten, and the body subconsciously resists sensation. This neurological pattern is often mistaken for hormonal decline, when in fact it's emotional inhibition shaping a physical outcome. Therapeutically, the first step to reversing this pattern is acknowledging the psychological component without judgment. A simple grounding exercise, placing one hand on the chest and the other on the abdomen, can regulate breathing and calm the amygdala. Deep, slow breaths increase vagal tone, allowing the parasympathetic nervous system to take over and reopen the body's capacity to receive stimulation. On an emotional level, creating a sense of permission is crucial. Women who approach self-touch as self-care rather than performance report significantly higher satisfaction and less discomfort. Lighting a candle using soft lighting or simply setting aside uninterrupted time can shift the brain from evaluation to experience. Clinical sexologists often describe this transition as moving from observation mode to embodiment mode. In essence, your emotional state directly determines your physical response. The body cannot relax into pleasure if the mind feels unsafe. Reframing self-touch as a practice of reconnection, one that honors biology, not defies it, allows both systems to align again. Once this balance is restored, another key element must be addressed: the physical foundation that supports every sensation. The pelvic floor, the muscle group that often weakens silently yet profoundly shapes arousal and satisfaction. 6. Neglecting pelvic floor health. Few women realize how central the pelvic floor is to pleasure stability and circulation. These deep muscles form a supportive sling for the bladder, uterus, and vagina, yet they also play a crucial role in blood flow, nerve signaling, and muscle contraction during arousal. When these muscles weaken or tighten excessively, a condition that affects nearly 1 in 3 women over 50, sensation and orgasmic response both decline. Physiologically, the pelvic floor functions like a pump. Each gentle contraction pushes oxygen-rich blood into the tissues of the vulva and clitoris, while each release allows fresh circulation to return. Over time, hormonal loss, childbirth, sedentary lifestyle, and chronic tension can interrupt this rhythm. When the muscles become weak, blood stagnates and sensitivity fades. When they become overly tight, nerve pathways are compressed, leading to pain or numbness. Both extremes can leave a woman feeling disconnected from her own body. Medical imaging studies confirm that women who regularly perform controlled pelvic floor exercises experience a measurable increase in genital blood flow and improved lubrication. Even more importantly, strengthening these muscles improves nerve conduction through the pudendal nerve, the primary channel that transmits pleasure signals from the genitals to the brain. For women who experience urinary leakage, heaviness, or decreased sexual sensation, these exercises often provide the first noticeable improvement. Beyond the physical, there is also a psychological aspect. The pelvic floor mirrors emotional tension. Chronic stress, suppressed anger, or anxiety can manifest as persistent tightening. Learning to contract and release consciously can therefore serve as both a medical and emotional reset. Gentle Kegel exercises, guided breathing, or working with a pelvic floor physiotherapist can restore coordination and awareness. Most women begin to notice better responsiveness and comfort within 3 to 4 weeks of consistent practice. Maintaining pelvic floor health is not simply about strengthening, it's about creating flexibility and resilience. When these muscles regain balance, the body can once again synchronize breath, blood flow, and sensation. With this physical foundation restored, there remains one final misconception that continues to limit many women: the belief that self-pleasure is merely a substitute for intimacy with a partner. 7. Believing self-pleasure is only a substitute for sex. Among the most persistent myths I hear from women in their 50s and 60s is the idea that self-pleasure is something one settles for when a partner is unavailable. This belief quietly undermines both confidence and health because it frames arousal as conditional, something dependent on another person, rather than as an intrinsic biological function that benefits the body on its own. From a medical standpoint, self-stimulation supports several hormonal systems that often decline after menopause. Regular arousal releases oxytocin, prolactin, and nitric oxide, all of which enhance blood flow, calm the nervous system, and support cardiovascular health. Research from the Journal of Sexual Medicine shows that solo stimulation can raise oxytocin levels by nearly 50%, improving sleep quality and lowering blood pressure. In addition, consistent orgasmic response boosts immune markers and helps maintain pelvic floor tone by engaging those same muscles that weaken with age. The emotional implications are equally important. When a woman learns to experience pleasure independently, she reclaims authority over her body's rhythms. Many of my patients describe feeling more relaxed, less anxious, and more connected to their sense of identity once they stop viewing self-touch as second best. This shift has a measurable neurological benefit. Positive emotional association activates the prefrontal cortex and limbic reward system, strengthening the brain's response to pleasure and reinforcing healthy hormonal feedback. For women in relationships, self-pleasure also enhances partnered intimacy by clarifying what feels comfortable and pleasurable. It encourages communication grounded in awareness rather than performance. For those who are single, it provides a powerful way to maintain circulation, hormonal balance, and emotional equilibrium. Understanding self-pleasure as a form of hormonal maintenance reframes it from taboo to therapy. It is not a substitute for love. It is one of the ways the body sustains vitality, balance, and confidence throughout the later decades of life. Now that we've explored the 7 most common medical mistakes and the science behind them, it's time to focus on how to apply this knowledge safely and effectively in daily life, so your body can begin to respond the way it was always meant to. Before changing any technique, it's essential to understand what your body biologically needs after 50. Hormones, circulation, and nerve health work together, and small medical adjustments often bring meaningful improvements. These steps focus on restoring natural responsiveness rather than chasing temporary results. Start by reviewing your hormones and medications. Low estrogen DHEA or thyroid activity can interfere with arousal and lubrication, while elevated cortisol blunts desire. Some antidepressants and blood pressure drugs reduce dopamine, the neurotransmitter of pleasure. A simple consultation and hormone panel can reveal whether chemistry, not willpower, is the barrier. Next, stabilize your nervous and hormonal connection. The vagus nerve links the brain and pelvic organs, controlling relaxation and blood flow. Practicing 3 minutes of slow breathing, 4 seconds in, 6 seconds out, lowers cortisol and boosts pelvic circulation. Adding foods rich in phytoestrogens like flaxseed, soy, and pomegranate helps balance hormones. Magnesium and vitamin B6 support serotonin and relieve muscle tension in the pelvic floor. Then retrain pelvic circulation. Gentle Kegel contractions, seated pelvic tilts, and light abdominal massage improve oxygen exchange and tissue warmth. Just 10 minutes daily can restore vascular flexibility and enhance sensitivity. Equally important is preparing the psychological environment. A quiet, private space signals safety to the nervous system. Writing a simple affirmation such as, "My body is capable of pleasure and healing," reprograms the brain from guilt to acceptance. This process, known as cognitive reassociation, helps reduce fear signals in the amygdala and reactivates the brain's reward pathway. Finally, track your progress. Notice 3 signs: improved moisture, warmth in the pelvic area, and post-touch relaxation. When these appear, circulation and hormone balance are improving. If discomfort continues beyond 6 weeks, consult a menopause or pelvic health specialist. Therapies such as low-dose estriol creams, vaginal laser treatments, or platelet-rich plasma can safely restore tissue health. Recalibrating your body isn't about performance. It's about reestablishing communication between your hormones, nerves, and mind. With steady attention, pleasure becomes not a goal to reach, but a natural reflection of health and vitality returning. The truth is that pleasure after 50 is not lost. It simply changes form. As estrogen circulation and nerve sensitivity decline, the body requires more understanding, not more effort. By recognizing how hormones, blood flow, and mindset interact, you can restore sensation, comfort, and confidence without shame or fear. Every adjustment you make, hydrating the tissues, breathing slowly, strengthening the pelvic floor, or simply giving yourself permission to feel, helps the nervous system and hormones work in harmony again. These are not cosmetic routines. They are signs of a body reclaiming balance. When you treat pleasure as a measure of health rather than indulgence, it becomes an essential part of your overall well-being. Remember, your body is not failing you. It is asking for care, patience, and informed attention. The science is clear. Circulation can be retrained, nerves can recover, and intimacy with yourself can remain vibrant at any age. Thank you for spending this time with me. If today's video helped you understand your body better, please subscribe and help me reach my first 10,000 subscribers so I can continue sharing evidence-based guidance for women like you. And don't forget to leave a comment. I truly value hearing your thoughts and experiences.